Hi everyone. In honor of Movember, a month that is known to raise awareness of men's health, I'm going to kickstart a series called Men's Health Mondays, where I post a video every Monday of this month raising awareness about common men's health issues. Again, this is not meant to be medical advice. The goal is to raise awareness about various health issues in hopes to encourage others to have this conversation with their primary care provider. With that being said, let's get on with today's video, which is going to be about BPH or Benign Prostatic Hyperplasia. Again, this is going to highlight general information about this condition. This is not going to be comprehensive. If you want further information, I encourage you to speak to your primary care provider, i.e. your nurse practitioner or your family physician. I chose to speak about benign prostatic hyperplasia, or BPH, due to its prevalence. A recent study in the Asian Journal of Urology reports that the prevalence of BPH rises with increased age. They've reported that at the age of 60, you're 50% likely to have some of the symptoms of BPH, and by age 90, you would have an 80% chance of having the symptoms. So as you can see, it is very common, and therefore it is important to at least have some sort of idea of what it is. So now that we know how prevalent it is, let's talk about what BPH or benign prostatic hyperplasia is. Benign prostatic hyperplasia, or BPH, is an enlarged prostate gland. The prostate gland surrounds the urethra, the tube that carries urine from the bladder out of the body. As the prostate gets bigger, it may squeeze or partially block the urethra. This often causes problems urinating. BPH occurs in almost all men as they age. BPH is not a cancer. An enlarged prostate can be a nuisance, but it is usually not a serious problem. What are some of the symptoms? Well, BPH can cause urinary problems like trouble getting a urine stream started and completely stopped. Often feeling like you need to urinate. This feeling may even wake you up at night. A weak urine stream, a sense that your bladder is not completely empty after you urinate. In a small number of cases, BPH may cause the bladder to be blocked, making it impossible or extremely hard to urinate. This problem may cause backed up urine, or what we call urinary retention, leading to bladder infections or stones or even kidney damage. Some common concerns about BPH is that it does not cause prostate cancer and does not affect a man's ability to father children. It does not cause erection problems either. So how is BPH diagnosed? Your primary care provider can diagnose BPH by asking questions about your symptoms and past health, and by doing physical examinations. Tests may include a urine test, a urinalysis, a digital rectal examination, which lets your doctor feel the size of your prostate. In some cases, prostate-specific antigen test, PSA, is done to help rule out prostate cancer. Prostate cancer and BPH are not related, but they can cause some of the same symptoms. Your primary care provider may ask how often you have symptoms of BPH, how severe they are, and how much they affect your life. If your symptoms are mild to moderate and do not bother you much, home treatment may be all that you need to help keep them under control. Your doctor may want to see you regularly, check on your symptoms, and make sure you don't have any other problems. So how is it treated? Typically, you don't need treatment for BPH unless the symptoms bother you or you have other problems such as backed up urine, bladder infection, or bladder stones. Treatment is focused on not reducing the size, as this is not possible. It is rather focused on reducing or controlling your symptoms. Here are some things that you can do that may help reduce your symptoms. Practice double voiding. Urinate as much as you can, relax for a few moments, and then urinate again. Avoid drinking caffeine or alcohol. They make your body try to get rid of water and can make you urinate quite frequently. If possible, avoid medicines that can make urination difficult, such as over-the-counter antihistamines, decongestants, including nasal spray and allergy pills. Check with your primary care provider or pharmacist about the medications you take. If home treatment doesn't help, BPH can be treated with medicine. Medicine can reduce the symptoms, but it rarely gets rid of them. If you stop taking medicine, symptoms return. If your symptoms are severe, your primary care provider may suggest surgery to remove part of your prostate, but few men have symptoms or other problems severe enough to need surgery. So that's a summary of BPH. If you enjoyed this video, please consider giving it a thumbs up and maybe consider sharing it with a father-in-law or a father you have, or maybe a uncle that's getting older. You may want to ask any family members that you may have if they exhibit any of the symptoms and encourage them to speak to their primary care provider about it. If you like this video, please consider giving it a thumbs up and let me know in the comments below if you know anybody that's affected by BPH. Thank you so much for watching, and we'll catch you in the next video.